Guys, some of this stuff is some of the stuff where you see it's very wordy, I'm gonna sort of try to breeze through it because I don't want to get too bogged down in like the science of it, but it is there. So if you want me to elaborate on anything, certainly ask. If you but you'll notice that I'm kind of going through it because I have a lot of slides in only an hour. So and it's a pretty intense topic anyway. So chronic pain solutions, here I'm going to be talking about really what that means and what it means for your body and how your body's adapted to this new situation it's in. How can you reset the body and recover naturally, right? So who we help in my practice, we help people who are, we just say that they're age 40 plus, just because, like I said, we've kind of centered around these chronic spinal problems, but 40 plus who want to stay active, healthy, and mobile. Ideally, we're good at helping people who want to stay off of pills, kind of avoid surgery and procedures if possible. If that's the route you want to go, we can certainly guide you and we work very closely with a lot of the pain docs and a lot of the spinal doctors as well. So, if that's indicated, we certainly can help you with that as well. But we want to get at what it is that we want to know on day one, what it is that you want to get back to. What's your passion? So we can really design a program that's truly tailored to you. So our mission is to empower others to become the best version of themselves through healing, movement, and mindfulness. And I will be talking a lot about healing, movement, and mindfulness. Another part of our mission is to energize our patients to fully participate in a healthy, active lifestyle by developing a comprehensive solution to the pain and give confidence to get back to doing what you love. My vision for the practice is to become the premier holistic PT and wellness clinic on Long Island, specializing in orthopedic, manual therapy, and pelvic health. So I'm a women's health specialist. So we do things like chronic pelvic pain or incontinence or postpartum sort of issues. So my core values are growth, and I constantly learning, growing, changing, adapting to the environment. That's a big part of the talk as well, that we need to adapt to our environment, change. Our bodies are changing every single day. Every cell in your body is changing. So it's wise to adapt your daily habits, your thoughts to the changes of your body, because they're happening regardless of whether we want to age or not. Faith, I know that I put my faith in my body. I put my faith in help. I seek help. I read a lot. So that's the faith part, and the impact. My goal is to make an impact on the community around me. So just a little quote for you guys. The cure of the part should not be attempted without the treatment of the whole. Believe that wholeheartedly. This is why I say that we're holistic. We do treat the whole person. That is something that I believe is super important to healing. I don't think that we can look at a hip and just think of a hip. We have to look at the whole person. We have to see, what is the base of support doing? What are the feet doing? What are the knees doing? Above, is the neck okay? So we're looking at everything. Just some pearls of wisdom over the years that I've taken up is that really we are very resilient. Our bodies are very, very resilient and capable of adapting, even in the presence of some real structural deficits or changes. That everyone deserves to heal. Movement is medicine. That's my favorite. Balance is not something you find, it's something you create. Pain is never permanent. I'm going to repeat that. Pain is never permanent. I know some of you might be feeling very, very stuck and that this is just the way it's going to be, but it's not. And this too shall pass. Our perception of our environment affects our physiology. And that's pretty impactful. I will talk about that somewhat throughout the lecture. So just a bit about healing. It's really a journey. It's really not a prescription. It's something that when you say, when you think about a journey and you think about something that you have to go through over time, changes have to happen, right? You have to change. You have to implement change. You have to adapt. You have to, something you may have always eaten in the past may not be sort of working for you anymore. You might just have to give up on something that you had been eating that is causing a problem. People do develop food sensitivities at any point in their lives. Movement is the key to restoring local nutrition to the tissue. And by that, I mean healing of the tissue and optimal function. Drugs don't cure pain, and surgery doesn't fix function. So those are really true facts. Drugs don't cure pain, they just manage it. And surgery, while it can change the structure, it won't change your function, right? So it's not going to change the way your muscles work. It's not going to change your alignment. It could, like I said, it could change the function, the structure rather, because you can get a whole new knee, but the muscles around it and the way you move is still the same. And that's your function. That's the way you function. Again, that we can only manage, pain with these pain meds, the injections and surgery. And again, if it's indicated, it's the best thing in the world. I mean, sometimes I've sent people for total hip replacement and it was like the best thing ever for them because it completely changed their lives. But that's the point of that, is that was totally indicated because the joint was just totally messed up. But we have to do our due diligence. You have to recover the muscles around it. I mean, there's been so many instances where I've had people who have had total hip replacements years prior who said that they did very, very little rehab, and their backs are messed up now, and because of all the muscle imbalances and the compensations that their body did in order to adapt to the new hip. So I can go on and on.
There it is.
So
Check it out. Get off. On here.
She's on. Okay, I'm going to get off.
So really, pain, I'm going to talk a lot about pain and what it means. It's not just a possibility, it's a guarantee. And it's a consequence of if there's impaired wellness and limited movement. So when there's impaired wellness and limited movement, really want to repeat that. If there's impaired wellness in the whole system, in the whole organism, if the wellness isn't in check and there's limited movement, pain is guaranteed. It's guaranteed that you're going to be in pain at some point. It doesn't have to be right away. Whether it's a health stressor that you've undergone, that you've had maybe surgery for something completely unrelated. Maybe it wasn't even musculoskeletal surgery. Maybe it was something for your heart or something organ related that has put you into bed rest. That's going to impair movement. So you're on bed rest and you're not, and your tissues will kind of like recoil. They'll get really stiff. They might even get painful, and movement has to happen, sooner than later. And this is a really good point, that the nervous system uses pain. Pain is just a conduit. It's just letting us know that something needs to change. That's it. It's you. Now, I'll get into this, but it's usually in a chronic pain situation where somebody's been in the same pain I've had people come to me who've been in pain for years. Chronic pain is anything over 3 months of the same pain, but I've had people for years of pain. The nervous system has gone haywire in this instance, that it's using pain to signal that there's a real problem. And usually it's that there's the tissue is overloaded somewhere. We have to find where that place is. It could be above the problem, it could be below the problem, it could be at the problem, or all three. And tissue loading, the way your body kind of stacks, is dependent upon posture. That's why we, make a big, huge stink about posture and movement. And our tissues response to loading is very variable, and it really depends on the person. So we can't really, we can't compare one person to the other. I just want to talk to you about a little bit about sort of the problem with over reliance on imaging, looking at an x-ray or looking at an MRI and saying, oh my God, that's it. Like, the doctor said this thing was terrible. I'm done. I have to tell you, we start to change and degenerate at a cellular level starting at age 25. I mean, like, you remember, we're still the same person, still the same organism that we were 100 years ago. Our circumstances around us are different. We're definitely living much longer, but that's because of technology. That doesn't mean that our bodies are very, very different on a cellular level. So your bodies are getting into this sort of like aging mode very early on. I mean, the life expectancy way back when was, 40 years old. Now it's 73. But most degenerative changes that we see on imaging is simply wear and tear related to stress of the life or just general aging, which is normal. Like I'm going to say normal aging. I mean, aging isn't bad, right? There's a way to age well. This is like all I think about, actually. So it's all I read about too. I'm kind of obsessed with aging well, and I'm only 41, but I want to age well. Tissue overload may accelerate the degenerative changes, right? So if you're in bad posture, if your muscles are really weak, if your endurance and conditioning is poor, yes, it can trigger a cycle of pain and inflammation. It can accelerate the degenerative changes. But there's a way to recognize when that's happening and stop it. Change the form, right? Really change structure, okay? Like a disc, right? A disc, it's just doesn't have a great capability of healing. It doesn't have a good blood supply. So when you injure a disc, it's kind of what it is. But we can certainly change the environment around that disc. Most signs of tissue overload that we see on imaging takes years to develop, right? Years and years to develop before the onset of pain. So when somebody comes to me and says, "Oh, look at this is so terrible," I'll say, "But you've had this for years. Like you've been like this. There's no way that, when your pain started is when all of this happened. There's no way. It's impossible." So how can fixing the problem that we're seeing on imaging really fix the pain? I'm just going to say that usually it doesn't. And that's the problem. And these kind of like false hopes that people have around what that's going to look like. So hang on. And obviously there's a problem with pharmaceuticals is that there is not a healing drug. I mean, healing happens from within, right? 42 to 71% of office visits for pain end up in a prescription drug. It shouldn't be. That's not the way it should be. You should get, prescribed a treatment with, someone who's knowledgeable around movement, like physical therapist, or maybe a coach, a personal trainer, something. The opioid epidemic has led to overdose to be the most likely cause of accidental death. I mean, it's out of control. You guys know that. It's completely out of control. Also, if you're taking medication for pain, your tolerance to pain is reduced because the brain is constantly looking for that fix. Your brain is distracted. You're not focused on healing. It's focused on getting the next hit. Prescription pain killers can actually worsen the painful response, making you even more sensitive to pain. So obviously, there's certain circumstances, again, just like surgery and injections, that, oh my God, I have an aunt who's suffering, unfortunately, with just really deep bone pain from cancer, and she's on morphine. I mean, she's crippled. She's hard. She feels terrible. So she's got to take something, right? Otherwise, the pain is constant. That's terrible. That kind of thing. It's lucky we have morphine, but not for like a musculoskeletal, not for a back problem. That shouldn't be with, you shouldn't be taking painkillers for that. So understanding pain, and this is where I think like having the 45 minutes one-on-one with people really helps, is that we have an opportunity to really educate. Besides the fact that I'm always like doing these talks and I'm always writing, I always write blogs, I'm always sending out things to people's homes and trying to just educate people that understanding the pain is really helpful with relieving it. So like I said, chronic pain is something that lasts more than 3 months and has affected your daily life in some way. And pain itself is a protective alarm system that something's gone wrong. The definition of pain is that there's an unpleasant sensory or emotional experience associated with actual or potential tissue damage. So the tissue damage may or may not be there, but the pain could be there. So I'll get into what I mean by that. So today we're going to kind of get into that, talk about why pain sometimes lasts way longer than it should. Does anybody have any questions so far? Everybody okay? All right. So what pain is not? It's not an experience that can be compared from one person to the other. I have this pain, you have this pain. Oh, how come you hurt that much? I mean, literally, there's no comparison. Cannot compare to your friends. Oh, my hip didn't even hurt. Oh, mine's killing me. Must be something wrong with you. Well, I mean, you'll see, everybody has a specific set of issues that's going to lead us down this path and why the pain is perceived to be what it is. It's not something that can be really simplified from, how much is your pain, 1 to 10. Although I will say that if you give it a number and you want to use that as a way to track your own progress, that's not a bad idea. And it's not always an indication, and this one may, confuse you a little bit right now, but you'll understand by the end of the lecture. It's not always an indication that the body tissues are injured, damaged, or unhealed. It could just be an altered nervous system, sort of the alarm system that's associated, the body's alarm system associated with pain could just be, or I always say to patients that the light switch is turned on. Okay, so there's pain receptors, or not pain receptors, there's pain signaling from the brain happening too much. So it doesn't have to be that there's still tissue damage to have pain. But it's not in your head, and you don't have to live with it. It's not in your head, you don't have to live with it. That's a fact. Okay, we can help. So acute versus chronic pain. So acute pain is your routine pain. You're obviously very familiar with this. You're going to touch a hot stove. You're going to take your hands off. The brain makes a reaction for you to remove your hands. And acute pain is adaptive and protective. It's really there to change, adapt to the environment, remove the hand from the hot stove, and to protect you. So then your hand is immediately going to feel painful. It's going to have some damaged tissue. You're going to have a normal inflammatory response. This is all very, very normal. Inflammatory response is there to bring healing chemicals and healing molecules to the area to actually recover the tissue. That's super normal. Chronic pain is something that's lasting. So that same tissue, it still hurts. It's not typical from a stovetop burn, but if it's lasting way longer than it should, and everyone's going, well, why do you still have pain? Even after sometimes the tissue damage or threat of future damage has been resolved. This type of pain is maladaptive, right? It's causing you to avoid doing things that your body absolutely needs to be doing. If you're avoiding bending, if you're avoiding lifting, if you're avoiding sort of like just movement, sometimes I have people who just are scared to walk or move. That's a fear avoidance. That's something that you've kind of adapted to the new scenario that's going on. I'll get into that more. Your pain with chronic pain can seem random. There could be no pattern to it sometimes. Pain that hurts one day could totally not hurt the next day. A lot of people with that. The pain can seem widespread. It's really difficult to pinpoint it. And sometimes the pain is really out of proportion to the amount of tissue damage. Or there could even be no tissue damage at all and the pain is still there. There's been a lot of research in the last 15 years, I would say 15 to 20 years, around pain that's there with no tissue damage. It's really fascinating stuff. I'm going to get into it. So here the brain is making good decisions based off of bad information from your spinal cord. Spinal cord, well, again, I don't want to confuse you guys. I'll get into spinal cord. So when pain becomes chronic, right, changes start to happen within the spinal cord. So the brain, and then coming out of the brain is your spinal cord, right? And that cord goes all the way down to your L2, and then it starts to splay out at the cauda equina. And at every single level of the spinal cord, you have these nerve endings that go and they innervate one side and the other side. And for the neck, it helps your arms move. And for the lumbar spine, helps your legs move. The spinal cord really houses a lot of our sensory information, the way we perceive touch, the way we move, vibration, all of that stuff is in the spinal cord. When the pain becomes chronic, there are real changes that happen in your spinal cord that allow too much messaging to happen from your brain and at a much higher rate. So the alarm system of the body, it's ringing loud, and your brain is responding with an output of pain. Our brain is the decision maker, right? So there's something, the spinal cord is going, something's happening, right? There could or could not be damage, but it's signaling something. And the brain then decides how to react. It decides, should I output pain or should I not? How does it decide? It decides off of your past experience with pain, your knowledge about the pain. So that's why I say education is so powerful. If you don't know why you're in pain and it seems so immensely scary, yeah, I mean, that's your brain is going to output pain. Your beliefs around pain, like, culturally, like, there's certain cultures that kind of like over exaggerate pain. Some cultures say, oh no, you shouldn't ever you don't ever say when you're in pain, and they kind of like bottle things up inside. That actually affects our pain. Or past successful behavior that you've had with pain or that you've observed in others. So being that the spinal cord is going to change if you've been in pain for long enough, at this point, I would want to tell you that if you have any kind of pain, don't ignore it. Because if it gets to the point that you're having a maladaptive response and the spinal cord is changing, I mean, it can be resolved, but it takes a lot more for sure. So don't ignore your pains, get it resolved really quickly. You're not like, that's a part of the culturally, like I know a lot of people who, oh no, I'm fine. Like they have to push through. Also, we live in a society of like, do, you never cannot work. It doesn't matter how much physical or emotional angst you're in, like just keep going. It's terrible for your body, and that's how you get into chronic pain. So, I mean, I think it's just like the way of our culture too, unfortunately, that we literally just don't, it's not okay to slow down. But at least, if it's feeling something, get the help for it sooner than later. If you've learned anything out of this, definitely go get some help. Even if it's like a minor neck ache that's been going on for a week, get it resolved. Because honestly, at that point, it's easy to fix. Gets to the point of chronic pain, not so easy. Okay, so far, that chronic pain, we have changes in the spinal cord, new pathways that have developed to alarm the brain that there's pain, right? At this point, there's a problem with the system. There's a system, it's like the computer system. I'm not really great with computers, but there's an issue here, and we need to reset. We need to like press reset on the system. Another system that becomes highly alerted to what's going on here, two other systems, super important. They work together. They're totally married, or is the nervous system and your endocrine system. Nervous system obviously has the nerves, and endocrine system has the hormones. So two types of nervous system within the autonomic nervous system is sympathetic nervous system and parasympathetic, right? Sympathetic nervous system is your fight or flight. It's your system that says, run from a bear, and everything turns on. You get flushed in the face, all the blood shunts to your muscles, and nothing goes to your digestive system when you're in fight or flight. That system was designed because back in the day, there was like a saber-toothed tiger chasing us, and we had to run, and we had to have a system already in our body to say, okay, just go, and it had to like adapt quickly. That's fight or flight. Parasympathetic system is the system of rest and digest. Under normal conditions, your body should be in rest and digest. In rest and digest, your digestive system actually works. In fight or flight, it does not. So a lot of people who have chronic pain are in fight or flight all the time because of the pain, and it causes anxiety, and you're in a heightened state of awareness. Also, like there's just a lot of input, right? There's a lot of input. There's social media. There's like you're constantly getting text message. Imagine like that phone. I mean, like obviously I use a phone as well, but like the constant messages, do this, do that. What are you doing? Why are you doing it? Always on the text line and the emails and respond. It's actually a lot. Our bodies aren't really supposed to be that way all day. We're supposed to be in a state of sort of like relaxed. And when you're in fight or flight, you're not digesting food either. So that's why a lot of people with chronic pain have digestive problems as well. Oh, what happened to my thing? Okay. So here's some signs. I'm not going to go through all of them, but here's some signs that you may be in fight or flight. Inhale more than you exhale. Your posture is very rigid. Your muscles feel tense all the time. You have trouble with digestion, difficulty quieting your mind. So about the hormones with the endocrine system, biggest one is our stress hormone, right? So when we're in pain constantly, and when we have, when we're in fight or flight, right? The body perceives that we're under stress. So the stress hormone, cortisol, gets used and utilized and pumped into the bloodstream too much. Normally, it should fluctuate. If cortisol is great because it wakes you up in the morning, you get a little rush of, energy from cortisol. It's good for when you're like, going to exercise, a little rush of cortisol. It's even good when you're managing an injury because you actually need cortisol to start the process of healing. But if it's utilized excessively because you're constantly in fight or flight and there's too much cortisol, you actually have a system that's flooded with inflammation. So here are the effects of elevated cortisol: increased inflammation, increased sensitivity to pain. So it's no wonder that the pain caused the fight or flight, caused the increased cortisol, and now you're even more sensitive to pain. Total vicious cycle. And because of fight or flight, you're always in fear, worry, and anxiety. There's depression. A lot of people, complain of fatigue, and your body, of course you're fatigued. Your body's like in this constant state of just trying to recover. It's exhausting. And a lot of times these same people are complaining of diabetes or weight gain and that you can't lose weight. Well, I have to tell you, if there's cortisol in the body, sorry, somebody wrote, yes, you can absolutely have these slides. I can give them to you guys. If there's cortisol in the body, it's very difficult, if not impossible, to lose weight. So I don't know if any of you have a goal of weight loss, but if there's cortisol, there's fight or flight, it's very, very difficult to lose weight. This cortisol, too much cortisol also causes poor memory, brain fog, and increases your chances of having, like dementia or Alzheimer's. So there's a lot of reasons to, want to solve this major, major problem. So when there's increased sensitivity to the pain, right? When the stress response is activated because of fight or flight and excessive cortisol, that prompts your body to create a fear-based memory around the event that happened, usually when you hurt yourself. So if you hurt your back when you were bending, forever and ever, your brain will tag bending, put a tag on bending. It's called a neurotag. And it will create a memory that says, when I bend, I have pain. Whether or not you actually have pain or whether or not the tissues are actually getting injured when you bend, your brain now says, when she bends or he bends, there's pain. So, and this I just threw in because I know a lot of my patients have their goal is to, lose weight and manage the diabetes. But I have to tell you that when cortisol is circulating in the bloodstream, there's also cortisol helps the release of sugar into the bloodstream. So then if there's too much cortisol, there's too much glucose or sugar as well. There's too much sugar in the bloodstream, okay? The sugar should be in the tissue, in the cell. If it's swimming around in the bloodstream, that indicates for your pancreas to pump out insulin. If you're pumping out insulin all the time, too much, you actually burn out those insulins of Langerhorn, they're called, where that's the part of the pancreas that pumps out insulin. Insulin grabs the glucose and it pulls it back into the cell. So pancreas goes, there's too much glucose, throw out the insulin. Insulin goes in, holds the hand of the glucose and brings it back into the cell. Now, if that's happening too much because there's constantly cortisol and there's constantly glucose in the bloodstream, those receptors at the pancreas are going to get burnt out. That's diabetes, basically. So the results, relatively speaking, we are safe, like relatively speaking, right? I mean, we just had a pandemic, nobody feels safe, but technically we're safe from famine, from angry predators, but your nervous system feels very differently. You're under a lot of stress, like technologically, right? Even the media, the news, very fear-based. It's all fear, 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 right? It's designed to keep you going and thinking and wondering, oh my God, what's going to happen? Is somebody going to give me COVID? Whatever. All this stuff, very, very taxing on the nervous system. So if you're already in pain and you have the news on all day, you should probably turn it off because it's not helping at all. And I one of my patients, I said that to her and she said, well, how am I going to know if anything's going to happen? And I said, your phone is going to ring so loud if something really bad happens that it's going to like pierce your ear. Like when whatever the tornado, it rings so loud, you'll know when something bad is happening. But unfortunately, the total life expectancy has increased since 1990, but our quality of life hasn't gotten much better, unfortunately, within the increase. You know what I'm saying? So past age 65, it seems that quality of life isn't that good for the vast majority. I want to help change that. So now you know that chronic pain leads to prolonged, perceived chronic stress in the body, too much cortisol, fight or flight, and it leads to a lot of other problems, right? Memory problems, energy problems, ability to focus, weight problems, fear, worry, and anxiety, which leads to more pain, actually. So any questions on that? Because that was like a little bit of physiology and stuff. Does anybody? No? So how do we get a handle on this? So this isn't like all-inclusive the answer, but that finding the root cause of the problem, resetting the alarm, and getting and staying healthy, basically. By finding the root cause of the problem, I mean that there are sometimes, I get people sometimes who've been in pain for so long, and there's something that was missed. A lot of times with people with back pain, as an example, there'll be like an SI joint problem that was there the whole time, where your pelvis is totally like, so you have a disc problem and you're going to disc, that's causing my problem. But then I'll get the patient and I'll see their pelvis is totally cockeyed, like it's all the way up. It's called an upslip, all the way up on the right. And of course, think of, there's muscles attached to either side of the pelvis, and if one side is up and the other one is down, all the muscles on that side are going to be in a constant state of tension and cramp. So if we can fix the malalignment, because we found like what the real problem was, we can have really good results. So I think that's a little bit, yeah. So with chronic pain, with acute pain, it's a strong mechanical stress to the body that will indicate pain, like an overstretching to the ligament or tearing of the muscle. Of course, that's very painful. But with chronic pain, the system, because of the cortisol, because of the fight or flight, is highly sensitive. So the smallest stressor, even like somebody calling you with bad news, will be a major issue. Low threshold forces even will be a major issue. Can't exercise, can't do your daily activity. I can't even put my dishes in the dishwasher. Even a massage hurts me. Light touch could hurt. So that is an indication that the system is very sensitive, highly on alert, and we have to figure out how to desensitize the system, as well as finding if there's a real like other issue that hasn't been found.
So here are some strategies to how we can reset the nervous system so that you can start healing. So firstly, a few things to consider, right? Restricting movement or like rest, being prescribed rest is no longer indicated. Rest as a treatment, it's not good. It only results in muscle atrophy or like a lessening of the strength of the muscle, lessening of the size of the muscle, poor control of muscle activation, and increased risk of tissue overload. So tons and tons of studies around this that nobody's doing bed rest anymore. It's out. Okay, if you have pain, you got to learn how to move slowly within the ranges that are safe for that moment. And you might need help with this, and that's okay. Pain should never be ignored. You should think of pain as, what's going on here? I got to figure it out. It's an opportunity. And sometimes the dysfunction can lead to adaptations in the structure, changing the structure potentially, which can create weak or degenerative segments. But like I said, if you get ahead of it, this is a problem. I feel the pain. Let's figure this out. Sooner than later, don't hold off. Don't go to work every day. Bless you. Don't go to work every day in physical agony. Figure it out. And if you have had surgery, that's fine. I mean, there's just work to do, right? I mean, there's been a major change in your body, especially if you've had like a replacement of a joint, hip replacement, knee replacement. There's work to do because those muscles now have a brand new joint that it needs to adapt to. So again, finding the root cause of your problem. Very often I see people in chronic pain that they'll agree that they've been mismanaged for too long, right? I even just had a discussion with a neurosurgeon friend of mine and we agreed. And he said that, like they've been to physical therapy, but it really wasn't good enough. They didn't find the muscle or joint imbalances. They weren't addressed. And so the problem persisted. So it's like, he even was just telling me that like, he'll see somebody who will come in and say, oh yeah, I'm just ready for surgery. Like I've been to physical therapy. Well, what did they do in physical therapy? Well, I was sitting in a big room and really nobody looked at me except for 5 minutes. That's really not physical therapy. So if you were mismanaged, I mean, you actually need to like get rehab, like real rehab. So, sometimes it's just like an easy hands-on treatment that can find the stiff segment, get it moving, show you how to move, tell you what to do, tell you what not to do so that we can start to recover. Or sometimes that you thought that, you should have been better sooner after surgery and that didn't happen. And that kind of fear over like, did I mess up the surgery? Did I do something wrong? Did the surgeon do something wrong? That even puts your body into fight or flight. Or surgery was performed and the outcome wasn't exactly how you expected it to be, or you didn't get the right type of post-surgical PT or help. So I would implore you to see somebody who takes a really deep history into previous injuries. If somebody's not asking you what you've been through that brought you here today, I would say that that's wrong. We have to have a detailed history of your previous injuries. What led you down this path? There is a slew. I mean, there could have been a string of events. Maybe it was sporadic bouts of pain, and a little bit of minor trauma along the way over years and years that coalesced into what it is today. But we have to know that, because if you had an ankle that you've been spraining for years and years, and you're wondering why your knee is so unstable, I mean, I'm going to look at your ankle anyway, but it's good to know that the ankle is not stable. And so thus neither is the knee and neither is the hip, and the back could be involved. One consistent fact about musculoskeletal pain is that the pain rarely occurs at the site of the problem. So as PTs, we have an opportunity to put different inputs into your higher centers and create new experiences. That changes chronic pain. It's pretty powerful that when that tissue lengthens, or when it does, or contracts, or gets shorter, gets longer, that your perception of the pain at that moment that we can teach and train the body to get rid of that neuro tag that I talked to you about, the change in the spinal cord. It's work, but it's doable. So this is like super important, this part about sleeping your way to good health. The biggest predictor of injury is previous injury. Like I said, that timeline of what you've been through, you know, what's happened to your ankle, what's happened to your knee, what's happened to your hip. Have you had chronic neck problems? Yeah, my neck gets gotten stiff. I always ask people, and they don't always tell me right away, but I dig, and I find it out that there was a long history of injury and lack of sleep. Okay. I can't stress this enough. You will not heal if you're not sleeping. I write about it. I preach it. I practice it. I'm in bed at 9:30. Your body needs, actually, when you're healing, your body needs more sleep. So the like minimum is 7 hours. If you're healing from something, you have to be sleeping more. So if you're tired, and you're not getting more than 7 hours while you're healing, it's no wonder. It makes sense. And most people are sleep deprived, unfortunately. There's a lot, like I said, a lot of people are in fight or flight because of the circumstances around us. But lack of sleep will delay healing. And how you feel when you're awake is dependent on how you slept. And disturbed pain is usually due to persistent pain, to anxiety, depression, all the stuff that puts us in fight or flight. Getting enough sleep activates the healing potential and improves tissue nutrition. Literally all the magic happens when you're sleeping. All your cells are recovering. There's no recovery in a deprived sleep person. So if you need help sleeping, I would say that that's probably should be on the top of the list of things to deal with, getting to sleep. So movement is medicine. Number 3, according to the Mayo Clinic, prolonged sitting has the same mortality risks as obesity and smoking. Having a physical job also does not void the need for variable activity, because if you have a physical job, it's likely that you're doing the same thing over and over again, and the body does not like to do the same thing over and over again. You need variability. You need to move in different planes of movement, right? You think about the neck, you got to go this way, you got to go that way, you got to turn both ways, up and down. That's what the spine wants, and that's what the body needs. You have to replenish strength and endurance daily. So what can we do daily? It could, and I wrote 15 minutes of brisk walking, but that's only if you're not, suffering. And a lot of you guys are suffering with pain with walking. So if 15 minutes is too long, start with 2 minutes, 5 minutes. Anything is better than nothing. 10 minutes or 5 minutes, doesn't matter, of yoga or stretching or coordinated movement. And by coordinated movement, I mean slow, coordinated movement that will help your problem. And that's a lot of times what we do is we design programs for people so that we can teach them how to move in a slow, coordinated way that is optimal for the joint that we're trying to heal. So if it's the neck, I'm telling people, okay, really slowly, and you have to breathe when you do it. Really slowly start to look down, come back with the breath, and do it repetitively. Because if you're in pain, you're not going to be able to. Maybe if you have neck pain and you go to, somebody calls your name and you go quick and your neck goes into spasm because that's how tight it is. So that quick movements aren't good. So to heal, we're going to have to slow it down. Progressive strength training with resistance is super, super important. It's important for all of us. The ladies, everybody should be using free weights or Pilates or body weight, actually, even yoga where you're getting down on the ground. That's great as well. That's considered progressive resistance training. And mindfulness. Okay. So studies show that meditation helps lower cortisol and decreases pain and depression and increases physical function and quality of life. There are actually so many studies out now about meditation and mindfulness. Mindfulness is the practice of maintaining a non-judgmental state of heightened or complete awareness around your thoughts, your experiences, and on a moment-to-moment basis. So we're not flying through the day, not knowing that the day, you can't believe it's 2 o'clock already. Taking a breath, stop through, maybe every couple hours or every hour, you just take a minute, take some deep breaths into your belly, through the nose, out through the nose. I'll teach you guys that. That practice actually releases opioid-like chemicals, almost like a painkiller, that are up to 33% stronger than morphine without the side effects. So how do we breathe? A lot of people have a dysfunctional or paradoxical breathing pattern. So the diaphragm is your main organ for breathing. It lives right under the lungs, okay, right in the rib cage. And it plays a really big role with chronic pain. And so chronic emotional stress or physical pain and increased mental load can alter respiratory regulation, right? It can make it difficult to return to that rest and digest system. With chronic stress, and when I say chronic stress, I mean like chronic pain, chronic stress from whatever, emotional stress, doesn't matter, that the diaphragm flattens and becomes very, very stiff. It's a muscle. So mobilizing, we work with people to mobilize. We actually get in there, we like move the diaphragm to lengthen it, and we teach you how to breathe. So I'll just do a little breathing technique with you guys. I hope you've been breathing this whole time. So just kind of relax your shoulders, all right? If you have something you're sitting against, that would be ideal. You could do this seated, you could do this in your bed, you could do it on your side, whatever position that your body's like physically not in a ton of pain, that would be the best way to practice breathing because you want to be comfortable. Okay, so ideally, like when you put your hand on your chest and then your hand on your belly, right? Just take a deep breath and just deep breath. Now, this is a little test for yourself, not testing, test yourself. If when you take a deep breath, the hand that's moving most is the hand on your chest, then you might have a dysfunctional way of breathing and you need to correct it. When you take a deep breath, the hand at the chest should not move, and the hand at the belly should be coming up and down with the breath, okay? And now that you know that, you can practice it, right? So put your hands here, put your hand on your belly, and take a breath in through the nose. But what I want you to do with your tongue is I want you to not keep the mouth open. I want you to take the tongue and put it on the palate, top of the mouth, okay? You can keep the mouth open, but the tongue should be, it shouldn't be with the mouth open, with the tongue out. So tongue is up. Take a deep breath through the nose, nice and slow, 5 seconds in. Hold it at the top, almost like you're going to starve yourself for air for a second, and then let it out of the nose, again, 5 seconds out, super, super slow. And the hand that should be moving is the hand on the belly. That's diaphragm breathing. And if you guys just take literally a minute, 2 minutes to do this a couple times a day, I can almost guarantee that something will improve in life. Okay, so you can practice that more on your own. So also, the power of positivity, whether you think you can or whether you think you can't, you're right, okay? Your beliefs affect your outcomes, okay? Or if you're telling yourself this, like everyone in my family has a bad back. Well, if that's the story you're telling yourself, you're probably not gonna not have a bad back, right? Don't give up. Even if it hasn't worked out a bunch of times, just keep trying, right? Because you shouldn't be in pain. You shouldn't be in pain for this long. Focus on what you're grateful for. Write it down even. When I was in a low place, I used to have a journal, and it was simple as this little construction pad book, and I used to write down all the things that I was grateful for, and I would look at them every day, and I would actually rewrite them because writing is, powerful for the brain. Just, and you can change the story that you've been telling yourself, that you don't feel that you deserve to feel better, whatever it is. Everybody has a little bit of a thing going on in their head that they tell themselves. So try to get at what is it that you're telling yourself that is holding you back? Not to get all psychological on you guys, but And my favorite and most probably, well, not most, though, everything's very important, but good nutrition and enough water. I can't stress it enough. Get rid of the junk food. Keep it balanced, keep it unprocessed, limit your sugar. Even too much fruit. I have patients who I make them write down what they're eating, and they eat a lot of fruit. Like most of it, it's fruit. Fruit is sugar as well. Look out for high fructose corn syrup. Do include fruits and veggies, but again, within moderation. Organic when possible. You can look at the Dirty Dozen group of fruits and veggies that really, like, these dozen groupings of fruits and veggies should be organic, because when they're not, they're pretty toxic. Stick with organic lean meats, meat, poultry, fish, eggs, omega-3 fatty acids such as salmon, mackerel, sardines, flax, fish oil, nuts. Drink more water. I always say that you're probably not drinking enough water. Probably, body 60% water. You've got to drink enough to support all the cells in your body, to support for healing. Can't heal if you don't have enough, water. And amino acids that come from protein, that actually builds your body tissue. So again, if you're protein deficient, you're not getting enough protein, you're not healing. So that could be another reason that you have pain for too long. You can control, you do control your portions. You can use a tracker. There's an app that's really, really easy to use, super easy to use. If it makes you like nervous to try to think about downloading it and using it, I can help you with that. Keep a food journal. That's a really, really great idea. Track what you eat. You'll see patterns. You'll figure out like what you're doing, that you could change. Put down what you eat, when you ate it, how you felt. If there was pain, you'll be able to adjust and change, and it'll work. It really is very powerful. You'll even pick up on food sensitivities. Like a lot of people who start doing that will realize, oh my gosh, every time I eat dairy, like my pain gets worse, and I actually have a stomach ache. Okay, no dairy. Don't skip meals. Don't skip meals. It's a terrible, terrible way to lose weight. You need fuel for recovery. Even for weight loss, you're actually not going to lose weight if you're skipping meals. Please. Too many of the women I treat skip meals. Don't skip any meals. Eating too little, like slow. Remember, your body's a machine, right? You got to fuel the machine. The fuel is the food and the water. If you eat too little, you're actually slowing down your metabolism. You're not a calorie burning machine anymore. You're in survival mode. Your body's trying to get you to survive because you're under eating. And you're also going to be deficient in vitamins, minerals, proteins to repair the tissue that's damaged that you're trying to heal from. Okay. All right. Sorry, I get very passionate about nutrition. Does anybody have any questions about that? All right, so I'm going to open it up to questions. I'll just do my little conclusion. So keeping your body well rested, active, mentally fit with meditation and mindfulness, fueled with a healthy diet, is your best defense against musculoskeletal disease. If you can change the function, meaning, okay, I have pain, I have an alignment, I have a posture problem, got to fix the posture. Better support the movement, then pain relief is possible, even with pretty damaged, parts of the body. The body is so capable of healing. Anybody can do it. And stress precedes, it comes before pain. So the consequence of experience of pain comes after overload of the body for a very long time. Like you've probably undergone too much tissue overload for too long. And the pain didn't come out of nowhere. Really think back, you've been at it for a while. It's just like the check engine light. The check engine light goes on only after something's been going on for a little while. Well, actually, I will admit I ignored my check. Like last night, I got stranded because I ignored my light that said the battery was low and my battery's not. So just take my own advice.
Shaden, there is a question in the chat about how much water is appropriate.
So water is about your body weight in ounces. Your body weight in ounces. Yeah. No. Yes. No. Divided by 2. I think it is divided by 2. Yeah. Your body weight in ounces divided by 2. Right. So if I'm 140 pounds, I should be taking in 70 ounces of water at least a day. And that depends on what you're doing, right? Like if you're exercising, you're going to need more water. You're using, you're using up some energy. So
What are your thoughts about intermittent fasting?
okay, so intermittent fasting is good for people who want to kind of like reset the system, put yourself in a way that you can give your digestive system a break from working. And if you're struggling with weight or usually like if you're struggling with weight, if you have a very, very high metabolism though, intermittent fasting can actually like lower your glucose too much and make you have headaches and make you feel unwell. So it's best with intermittent fasting, especially it depends on how long you're going to fast. If it's 12 hours, usually 12 hours is okay. But intermittent fasting, sometimes people recommend 16 hours. That's a really long time. So you want to like just run it by your doctor, even though most doctors don't have much to say about it. I have to say, this is what I would do. If you're fully capable, I would try it. You got to track how you're feeling. So maybe you start with a 12-hour fast, and that's pretty easy because you can go like you stop eating at 8 o'clock. You can wait to eat at 8 o'clock. That's not too bad. But if you want to push it to 13 hours, 14 hours, just want to like keep track of how you feel. But it isn't a bad idea
To stop eating at a certain time and start eating.
Okay, thank you.
Welcome.
Thank you.
So I was just going to tell you guys that it could seem overwhelming, like where do I start? But your body appreciates even one little change. So just even if you change one thing, do one of the things I said today, and it'll make a difference. Eat more proteins, don't skip meals, go to bed early, start moving, even 5 minutes will be really good. Does somebody have a question?
Yes, I have a question, please.
Vivian.
Yes. Over the decades of chronic pain, I have had a doctor say that I have Epstein-Barr. Another doctor said no. I had another doctor say I have fibromyalgia. Another doctor has said osteoarthritis. Another doctor said rheumatoid arthritis. And no matter what each one has prescribed as medication or anything like that has not worked. I am in agony every day. I really cannot even walk for more than a few minutes down the block and have to, I'm sorry about that, and I have to come back. Even my dog objects to that.
Of course, he wants to move.
How do I find the right doctor? I mean, I go with the exact same complaints. I point, I get an MRI. They all read the same things. They all went to medical school, preferably. How do I find the right doctor? And how do I find the right physical therapist if I should look for one? But I live in East Northport. I'm not going to travel. Anyway,
Okay.
Go ahead.
So thank you for sharing that. And I'm really sorry that you're struggling so much. I feel your pain. I mean, I hear this a lot actually. And all the things you listed, I wrote them down: Epstein-Barr, fibro, OA, RA. So they're all autoimmune problems. Okay. Autoimmune issues are because, again, there's an issue with systemic inflammation. Why is your body so inflamed on a systemic level? That's the part that we have to figure out. Not that there's one medicine that's going to fix all this, because it's not.
I'm really looking for someone, the right person, medical, I don't want a voodoo witch, but I just want the right person to say, here, Vivian, do this.
Yeah. Okay.
I promise I will do it.
I have a really good recommendation. So because
ready.
this problem is going to be systemic, it's overall inflammation in the body that it's sticking with you and somehow it's not going away. So now there's something in your body that's not doing what it should do, and we haven't figured out what that is. Is there a deficiency of a specific vitamin or a mineral? Is the body compensating in some way because of something that's so highly deficient that it's increasing something else? That's the way the body works. It compensates. So if there's something that's very deficient, it's going to pump out something else and could cause a major problem. I would see somebody who will look at every single vitamin, mineral, hormone in your body and assess in a holistic way what's what. So somebody like that would be a functional medicine doctor.
What kind of medicine?
Functional medicine doctor.
Functional?
So you can look them up on the Functional Medicine Institute. It's a website, and you can look up by location and you can see which doctor. Sometimes it's an MD. Usually it's an MD that specializes in this holistic type of care. Where they will look at everything in your blood work. The blood work will be, 4 times the amount of what a typical doctor would look at. And they find the real issue, what's going on. They'll change your diet. They'll change a lot about your daily habits, because it can't be that you have to be like this. It's
Thank
crazy.
you. I am willing. That's what I needed. I did also go to a pain management person.
Yeah.
For note.
Yeah, I mean,
I will look
like I
into.
said, pain
I will-
management is managed. It's just managing it. Is
Okay.
it gonna, yeah.
So it's called functional medicine. I will.
Functional
look it up.
Medicine Institute. If you look it up online,
I will.
yeah.
I'm sorry if I took up
No,
a lot
you're
of
good.
time
You're
from
fine.
everyone.
Fine.
Thank you.
You're welcome.
Can you hear me?
Yes.
I'd like to know, I had trouble zooming in to you. Could you give me your name?
Shaden Ghattas. I'm the
How do you spell it?
Shaden. So here,
Can you put it on the screen, Shaden?
Yeah. This is all my info. Of course, my name isn't there, but that's the email, that's the website, that's the phone number.
Could you hold it so we could copy it?
Yes, absolutely. Here you go.
Uh,
Also, I just want to tell you guys that I give away free discovery visits. Like if you're not sure if we can help and you just want to have a conversation, just like we had with Vivienne, something simple as like a 20-minute conversation, a consult, through the discovery visit. And I give those away for free. So you guys can get that from me, from my practice. I have 5 physical therapists. They're all fabulous.